Hello, I'm Jon Emery. I'm Professor of Primary Care Cancer Research at the University of Melbourne. So bowel cancer is the second largest cause of cancer deaths in Australia. The risk increases with age, and so the group aged 50 to 74 contribute to the largest number of cases in Australia. Roughly 100 people die each week from bowel cancer in Australia. One of the problems is it has relatively few symptoms at an early stage, but we know that early detection really improves outcomes. So we can cure nearly all cancers if it was detected at its very earliest stage, but if it's diagnosed at a late stage, then only 13% of people will live long term after their diagnosis. So the National Bowel Cancer Screening Programme uses the immunochemical FOBT or fecal occult blood test. It's sent every 2 years to patients between the age of 50 and 74 and it arrives in the post. So the immunochemical FOBT test is a very accurate screening test. It's been shown in trials to be a very cost-effective way to save lives from bowel cancer. Compared to colonoscopy, which should be used as a diagnostic test in people either with symptoms or following an immunochemical FOBT test that's positive, or alternatively in those people who are at higher risk of bowel cancer due to their family history as defined in the National Cancer Council Australia guidelines. As we see in this diagram, if we imagined offering colonoscopy to the whole population as a screening test compared to FOBT, in an average risk population, the overall balance is such that you actually cause more harms, and this is why we only recommend colonoscopy as a screening test to people who are at higher risk of bowel cancer, and the FOBT test is a much safer and more cost-effective test in people at average risk of bowel cancer. Currently, the National Bowel Cancer Screening Programme has a participation rate of only 4 in 10. We know that if we could increase the participation rate to 60%, over the next 20 years we could save 84,000 lives from bowel cancer. The National Bowel Cancer Screening Programme is the single most effective way to reduce mortality and improve survival from bowel cancer. General practice is a vital part of the National Bowel Cancer Screening Programme. Start the conversation with your patients. You could save a life.